Hello, I am Dr. Sundeep Salvi, Director of Chest Research and Training Private Limited, located in the city of Pune in India. I'm sure you see a lot of patients coming to you with a symptom of cough. It is one of the most common reasons for which a patient visits a doctor. Let me share with you some secrets about how listening to the cough, you can make a diagnosis of the underlying cause. And let me show you how. So remember that a cough is an expiratory act when you have to blow out forcefully against the closed vocal cord. So pressure has to be built up for the air to push whatever is there in the respiratory tract outwards. Now, if the problem is much deeper into the lung, so such as in the alveoli, then the pressure that needs to be generated to push is smaller because the pressure starts from the alveoli. So it's like a ball that I've kept over here. I have to move it forward. I will require less pressure. When I move the ball forward, I require more pressure. And when I move the ball more forward, I require more pressure to move the ball forward. So when the ball is very close to you, that is a problem that you have in the alveoli, interstitium, or in the blood capillary. So the diagnosis can be pneumonia, pulmonary fibrosis or lung fibrosis, and heart failure. In these patients, the cough is very classical. Let me show you how. The patient does not take a deep inhalation and gives multiple weak coughs like this. Classical. The moment you listen to this kind of a cough, it could be pneumonia, lung fibrosis, or a heart failure. As simple as that. When the problem is a little higher in the small airways, small airways is predominantly affected in patients who have COPD, chronic obstructive pulmonary disease. And these patients have a very classical cough. The cough is like this. The moment you hear this kind of a cough, you know that the problem is in the small airways. And this is classically what happens in patients of COPD or emphysema. When the problem is little higher up, in the medium size of the airways, such as what we see in bronchitis or asthma, then the cough is a little louder. The person takes a little deeper breath and gives louder one or two multiple coughs like this. This kind of a cough. Deeper inhalation, multiple louder coughs is bronchitis or asthma. When the problem is higher up in the sound box or in the trachea or in the pharyngitis, then the cough is very different. The person takes a deep inhalation, fills the lung with as much air as possible so that a lot of pressure can be built up, and that pressure can throw off whatever is there in the upper respiratory tract. So the cough is very classically like this. One deep inhalation and one big boom. That is classically seen in pharyngitis or upper respiratory tract infections. There is another variety of cough that I've seen quite a lot is the whooping cough. You know how the whooping cough is? I'll show you. During inhalation, when the patient is finding it difficult to take air in, that is the classical whoop seen in whooping cough. That whooping cough is caused by a very specific bacteria. So just by listening to the patient cough, you can tell what the underlying diagnosis in the lung is. I hope this will be useful for you in your clinical practice.